The reality is that no statutory services can reach all communities and all their needs. And I think we've learned that actually faith communities are huge resource bases that have an ability to get to people who statutory services may not be fully meeting the needs of. So I think one of the things about faith communities is that they're with people through their whole life course. And of course, in providing health services or promoting health, we're also trying to reach people, influence people, and to provide services to people throughout their life course. Faith communities are alongside them throughout that whole journey, and therefore why on earth would we not work with them? The point about working with faith communities is that clearly the very act of faith is a positive and value-based is a decision or set of decisions, and therefore it can fit very well with public health messaging around promotion of sort of positive lifestyle choices. I think there is great need out in our communities. There are lots of individuals who are struggling, and we live in a very sort of fragmented society now, where often people live away from their families, and faith communities provide hubs that can reach out to people, find those people, identify them, draw alongside them, and help to meet their needs. One of the things that I hope that faith communities will increasingly do, without in any way losing the fundamental altruism that lies at the heart of their activity, is to become more professional around the way that they provide some of these services. And what I mean by that is really forming networks, so that what you might be able to achieve in an area is different from what you might be able to achieve in a single institution. And while we never want faith communities to mimic statutory services, because then they would lose their what makes them special, it's possible, I think, at least for some of our faith communities, to do more by being actually better organised and better networked together.